Good afternoon. I am Dr. Ancha Ceesay, a medical officer at the Obstetric and Gynecology Department in the Kanifing General Hospital. I graduated from the University of the Gambia, and also I'm a beneficiary of the Merck Foundation. I'm a Merck Foundation alumni. I did assisted reproductive techniques training in India for a duration of 3 months. That was back in 2019. And I'm currently benefiting also from a postgraduate diploma in Sexual and Reproductive Health from the University of South Wales. Before the training that I gained from India, I used to see infertility patients in my clinic, but the number has doubled since they've learned that we have infertility specialists in our facility. Also, the confidence that the patients are having now has increased compared to initially. At the end of each day, we tend to see about 3 to 5 cases, which wasn't like that initially. Also, I have gained knowledge and skills that I've been using to impact the lives of my patients, and these have benefited them. And we also have success stories, that is individuals that we have that had infertility issues that we were giving treatment to, and then they were able to conceive. And then at the end of the day, now they're having their babies with them. As we understand, there's a lot of stigma attached to infertility in our community. It's not only in Africa, but in our community also at large. And then the burden of infertility is mostly on women, because there is that notion that it's only a woman that can be infertile. But because of this training and course, it has also broadened our knowledge and enlightened us. So the scope of infertility, and then the way we can now talk to our patients, we have made them understand that infertility is not only a woman issue. It's a whole. It should be holistically approached. It's a complex thing that does not only involve women. So now we are seeing more patients there is more partner involvement now compared to before, and more patients are now coming to our facilities, hearing that we have infertility specialists here. And this is all due to the training that we had, that we benefited from the Merck Foundation. As an individual, personally, my level of confidence increased because before you see patients with infertility issues, but the knowledge we had was just basic, so you can't do much for them. But having gone through this course, it made us understand so many complex issues when it came to infertility. So it's not only we gain knowledge, but the patients are also gaining treatment and management and counseling from us. So that is one of the things, and at the end of the day, some patients we have also treated have conceived, they have their children. So that smile that you just bring to a patient's face, it's the whole thing for us at the end of the day. So that is some of the gains that I will say we have, and all thanks to the Merck Foundation. My final word would be that they should not just stop at us, because we have been trained, but still in the Gambia we don't have a infertility center. So we're still calling on them, because now we have so many specialists that have been trained, but still we need a infertility center where we can explore our skills so that we can benefit more. Because we are basically doing medical treatment, but we can also do certain surgical treatment, certain skills that we have learned. So if at all we have an infertility center, it would be of great impact, because we now have the expertise here, but we need the resources to at least set up a center, or to have a center here where we can see women with infertility issues and give them better care.